Exploring lung function tests, importance in medical practice. Introduction. Lung function tests, also known as pulmonary function tests, PFTs, are a suite of diagnostic procedures aimed at evaluating the functionality and capacity of the lungs. These tests encompass various measurements that assess how well the respiratory system is functioning, including lung volume, capacity, airflow, and gas exchange. In this comprehensive guide, we'll delve into the intricacies of lung function tests, their significance in medical practice, and their critical role in diagnosing and managing respiratory conditions. Understanding lung function tests. Lung function tests encompass a range of measurements that provide insights into different aspects of respiratory function. Spirometry. Spirometry is one of the most common lung function tests and involves measuring the volume and flow rate of air that a person can inhale and exhale forcefully. It assesses parameters such as forced vital capacity, FVC, forced expiratory volume in 1 second, FEV1, and the ratio of FEV1 to FVC, FEV1, FVC, which are essential indicators of airflow obstruction. Lung volume measurements. These tests evaluate the total lung capacity, TLC, residual volume, RV, and functional residual capacity, FRC, to assess lung volume and capacity. They provide valuable information about lung elasticity, compliance, and the presence of air trapping. Diffusion capacity testing. This test measures the ability of the lungs to transfer gases, such as oxygen and carbon dioxide, across the alveolar capillary membrane. It is crucial for assessing gas exchange efficiency and detecting conditions such as pulmonary fibrosis and emphysema. Bronchial provocation tests. These tests assess airway responsiveness by exposing the airways to substances that trigger bronchoconstriction, such as methacholine or histamine. They are commonly used in diagnosing asthma and other airway hyperreactivity disorders. Exercise testing. Exercise spirometry evaluates lung function during physical exertion and can reveal exercise-induced bronchoconstriction or limitations in oxygen uptake. Importance of lung function tests in medical practice. Lung function tests play a vital role in medical practice for several reasons. Diagnosis of respiratory conditions. Lung function tests are indispensable tools for diagnosing a wide range of respiratory diseases, including asthma, chronic obstructive pulmonary disease, COPD, interstitial lung disease, and pulmonary hypertension. By assessing lung function parameters, healthcare providers can identify airflow limitations, gas exchange abnormalities, and other signs of respiratory dysfunction. Assessment of disease severity. Lung function tests help clinicians assess the severity and progression of respiratory conditions. By comparing patients' lung function results with established norms or previous tests, healthcare providers can determine the extent of lung impairment and tailor treatment plans accordingly. Monitoring treatment efficacy. Lung function tests are valuable for monitoring the effectiveness of treatment interventions in patients with respiratory diseases. Regular testing allows healthcare providers to track changes in lung function over time and adjust treatment strategies as needed to optimize patient outcomes. Preoperative evaluation. Prior to certain surgical procedures, particularly those involving the chest or respiratory system, lung function tests may be performed to assess a patient's lung health and determine their risk of perioperative complications. This information helps surgical teams make informed decisions regarding anesthesia and postoperative care. Occupational health assessment. Lung function tests are utilized in occupational health settings to evaluate the respiratory health of workers who may be exposed to airborne pollutants, toxins, or hazardous substances in the workplace. These tests help identify individuals at risk of occupational lung diseases and inform preventive measures to minimize exposure. Exercise physiology. Lung function tests are valuable tools in sports medicine and exercise physiology for assessing an individual's respiratory fitness and performance capacity. These tests can provide valuable insights into how well the lungs respond to physical exertion and can be used to optimize training regimens for athletes and individuals participating in exercise programs. Conclusion. Lung function tests are indispensable diagnostic tools in medical practice, providing valuable insights into respiratory function and aiding in the diagnosis, management, and monitoring of respiratory conditions. By assessing lung volume, airflow, and gas exchange, these tests help healthcare providers evaluate lung health, diagnose respiratory diseases, assess disease severity, monitor treatment efficacy, and optimize patient care. As such, lung function tests play a crucial role in improving patient outcomes, enhancing quality of life, and promoting respiratory health across diverse clinical settings.